At this time, we have 42 patients who participated in the study that we are presenting. And the most remarkable finding from our study is the number of children who suffer from mental health problems. In our preliminary data studies, that is including 42 children, we have noted that about 62% of patients do have mental health problems as depression, anxiety, or cutting. And with the starting of treatment and acknowledging of their gender dysphoria, vast majority of these children do improve. And this is, in our view, really great data and information. So being pediatric endocrinologists, we provide care to pediatric populations, and the patients that we see, their ages range from 5 until 21. The average age of patients coming to our clinic is around 15 and a half, and it did not differ from children who are male to female or female to male. Actually, transgender care is not new, and it has been provided in several centers around the US and certainly many more centers in Europe for decades. We seem to be nowadays more accepting society, and therefore it seems that there are more children. And certainly in our clinic, the numbers of new patients is rapidly increasing. Data from our clinic is showing that there are more natal females who are transitioning to male. And this data is different from what has been seen in European studies.
Before we opened our clinic 2 to 3 years ago, a lot of adolescents that were transgender were seeking help at places further away like Los Angeles or other places, or were just delaying diagnosis because they didn't really have a good place to come to and seek attention. I think people are coming to attention at an earlier age. And despite that, I think still a lot of the people are still probably coming later than we would hope them to come. And that impacts their behavioral health, because we uniformly find that the longer they wait with it, the more stress it adds to their condition in terms of their breast development in natal females is much more evident, and they have menstruation that adds to their stress levels. And patients that were born male, they feel more and more uncomfortable with their facial hair, voice changes. And so we're hoping that now that we have this clinic available to patients locally, that they'll be able to come in at an earlier age where the interventions that we can have and apply are going to be more beneficial for their future mental health.